Our next speaker is Roy Netzer, and he is currently pursuing a master's degree at the University of Haifa, where he also got his bachelor's degree. So his topic of presentation is clinical competency and managing malnutrition sarcopenia syndrome among physical therapists, a cross-sectional survey.
Okay. Hello everyone, my name is Roy Netzer and I'm happy to share with you our research titled Clinical Competency in Managing Malnutrition Sarcopenia Syndrome Among Physical Therapists, a Cross-Sectional Survey. Let me start with a brief case. An 18-year-old man arrives for physical therapy after hospitalization, experiencing fatigue, unintentional weight loss, and significant muscle weakness affecting his daily function. Although referred for rehabilitation, no formal assessment is performed for malnutrition or sarcopenia, and unfortunately this scenario is not uncommon. Malnutrition Sarcopenia Syndrome, or MSS, is a clinical condition affecting older adults, leading to severe reductions in body weight, muscle mass, strength, and physical function. Despite being preventable and treatable through nutrition and physical activity, this condition is under-recognized and under-treated, particularly among physical therapists. Malnutrition and sarcopenia are serious health issues, each linked to increased morbidity, mortality, reduced quality of life. When coexist as MSS, these risks dramatically escalate. Previously, we found that physical therapists hold positive attitudes and beliefs toward the integration of nutritional assessment and counseling in physical therapy practice. However, there remains actual limited knowledge and interprofessional practices. Given our essential role in detection and intervention processes during the rehabilitation process, this study aim was to further examine the clinical competency of physical therapists in managing MSS. We conducted a cross-sectional survey from January to August 2024. 337 physical therapists participated via the Qualtrics platform, answering questions across 5 critical domains: MSS knowledge, prior familiarity with MSS, clinical screening and treatment skills, attitudes and beliefs toward MSS, and interprofessional collaboration practices. And we analyze data using correlation tests to assess relationship between domains. So as our result shows, the participant mean age was 41 years old with 14 years of professional experience. You can see in the first graph that physical therapists had general familiarity with MSS with 52%. However, only 4% has knowledge about the clinical diagnostic criteria for malnutrition and sarcopenia. In a manner of knowledge, you can see that 17% of the physical therapists have a general theoretical knowledge about MSS. However, the clinical assessment and treatment skills were very low, with 30%, reflecting a crucial between theory and practice. In a manner of attitudes and beliefs, physical therapists had a moderate positive attitudes and beliefs toward MSS management. They think it's important to assess and treat it in clinical practice, as you can see in the longer bars. However, they had low self-confidence in their abilities to treat and assess MSS. In a manner of the interprofessional collaboration, you can see that in sarcopenia care, 59% of the physical therapists collaborate with other healthcare professionals, mainly dietitians and physicians. However, in sarcopenia, in malnutrition care, there was limited to no cooperation, with 65% of physical therapists who did not cooperate. Our main result is that PTs, like physical therapists with prior familiarity and education of MSS, had better results in every domain. Better attitudes, better beliefs, better knowledge, and stronger interprofessional collaboration. So, these findings clearly shows that the clinical competency of physical therapists in MSS is limited. While physical therapists had generally positive attitudes towards the integration of nutritional assessment and counseling, they shows low MSS confidence, limited clinical skills, and insufficient interprofessional practices, mainly in malnutrition care. However, the positive news that with prior MSS education, the competencies of the physical therapist is much higher and the collaboration is better, so we have a hope. So our main recommendation is to embed MSS education in physical therapy curricula and practical training, to clearly define the professional roles of physical therapists in MSS management, and to foster interprofessional structured pathways. We believe that by equipping physical therapists with the right competencies, we can transform MSS, or an under-identified condition, into one that is actively identified and effectively managed, ensuring that our patient, 18 years old patient from the beginning, slips to the cracks and receive the best care. Thank you. If you want to read the full paper, you can scan the QR code upstairs. Thank you.
Thank you very much. If you just give us a minute, we just want to see if we can